The other aspect of the tummy tuck, which is very important to get the best result, is the tightening of the abdominal wall. And what I mean by that is that you have your skin, you have a layer of fat underneath the skin, and then under that is a layer of muscle. And the muscles there include the rectus abdominis, which is the six-pack muscle, and then there's some what we call external oblique muscles on the side, just different layers of muscle that create this very tough, what we call abdominal wall that holds all our organs inside. And that's a very important layer, as you can imagine, and it's generally quite strong and tough, and it does its job. But when a woman has kids, that layer gets stretched out, which is very common. It's not a health concern, it's something that happens. Along with that, the ab muscles get separated so that they are a bit weaker and they don't function as well. And also gaining and then losing a lot of weight can also cause this laxity, because when you gain a lot of weight, you gain some fat inside your abdomen, everything gets stretched out as a result, and then when you lose weight, things just don't shrink back. So that looseness of that abdominal wall layer, of that muscle layer, does cause bulging of the abdomen. And women will come to me and say, I've had 4 kids, they're all large children, everything feels like I'm still pregnant. My abdomen is still kind of large and distended, and people, they'll say very embarrassingly, oh, I was somewhere and somebody asked me, when my baby was coming. So, they still look pregnant because of that layer being stretched out and the abdomen still being rounded. To fully correct that, what we have to do is we build what's called a double internal corset all the way from the rib cage all the way down to the pubic bone. So we are tightening that muscle layer to a completely flat configuration so that it looks like how it did before a woman had children. And that's a very important part of this procedure. If that's not done properly, a woman will have bulging of the abdomen, they'll still appear rounded, the abdomen won't be flat. All those things are necessary to restore the abdomen to how it was, and that's what women want from this procedure. And that's another reason why I might see a patient who wants a revision, just because that muscle work, that muscle repair wasn't done properly.